Did you know watery, teary eyes can actually be a sign of dry eye? Welcome back to Eye Essentials. I'm Dr. Joseph King, and today we're tackling dry eye disease, one of the most common conditions I see in my practice. If your eyes constantly feel burning, scratchy, or irritated, this episode is for you. Dry eye affects millions worldwide and can really impact your quality of life, from difficulty reading to problems wearing contact lenses. The good news, we understand it much better now, and there are numerous effective treatments. We'll also bust a common myth. Did you know watery, teary eyes can actually be a sign of dry eye? I'll explain that paradox shortly. As always, this information is educational and doesn't replace proper examination by an eye care professional. What is dry eye and how do tears work? Dry eye occurs when your eyes don't produce enough tears. They don't make the right type of tears, or your tears dry out too quickly. To understand this, we need to talk about how tears work. Every time you blink, about 15 or 20 times per minute, you're spreading tears across your eye's surface. This tear film is essential for clear, comfortable vision. Your tears aren't just salty water. They're made up of 3 distinct layers, each with a specific job. The outermost oily layer comes from Meibomian glands in your eyelids. This oil sits on top of your tears like a seal, preventing them from evaporating too quickly. The middle, watery layer makes up most of what we think of as tears. It comes from lacrimal glands and keeps your eyes moist while washing away debris. The innermost mucus layer comes from the conjunctiva, the clear tissue covering your eye. This mucus helps tears spread evenly and stick to your eye's surface. Without it, tears would just roll off. When everything works properly, your eyes constantly produce tears to stay moist. With dry eye, something disrupts this delicate 3-layer system. What are the symptoms and causes? Well, common symptoms include a stinging and burning sensation, a scratchy feeling that there's some sand in the eye, and blurred vision, especially during reading or computer work. Your eyes might appear red, particularly in wind or near cigarette smoke. Contact lens wear can become uncomfortable or even impossible. Now, here's the confusing symptom. Many people with dry eye have excessively watery eyes. When your eyes are dry and irritated, they send a distress signal triggering your tear glands to produce more tears. But these reflex tears are mostly just the watery layer. They don't have the right balance, so you end up with eyes that feel dry but are also tearing excessively. What causes dry eye? Well, first, age. We make fewer tears as we get older due to hormonal changes. This is particularly pronounced in women after menopause. Medical conditions like Sjogren's syndrome, rheumatoid arthritis, and thyroid disease can contribute. Eyelid problems like blepharitis, where meibomian glands get clogged, are extremely common causes. Environmental factors play a huge role. Dry climates, air conditioning, heating, wind, and smoke all accelerate tear evaporation. Screen time is a major modern culprit. Your blink rate drops dramatically when staring at devices, from 15 to 20 blinks per minute down to 5 to 7. Less blinking means less tear distribution and more evaporation. Contact lens wear and LASIK surgery can also trigger dry eye. Finally, many medications reduce tear production. Antihistamines, blood pressure medications, antidepressants, and sleeping pills. What are treatment options for dry eye? Well, the most common treatment is artificial tears, over-the-counter eye drops that supplement your natural tears. You can use them as often as needed. If you're using them more than 6 times daily, switch to preservative-free versions, as preservatives can irritate your eyes with frequent use. We can also prevent your tears from draining away too quickly using punctal plugs. These are tiny silicone plugs that fit into the drainage openings in your eyelids. This procedure takes just a minute in the office, and it is reversible. Prescription eye drops can help your eyes produce more of their own tears, though they usually take several weeks to work fully. For Meibomian Gland Dysfunction, which is extremely common, warm compresses are incredibly effective. The heat melts the oils so that they flow freely. I recommend 5 to 10 minutes twice daily, combined with eyelid massage and specialized eyelid cleansers. The key to success is often combining approaches: artificial tears, warm compresses, prescription medication, and punctal plugs together. Prevention and daily management. Beyond medical treatments, lifestyle modifications make a significant difference. Add moisture to dry air with a humidifier, especially in winter. Avoid hair dryers and direct heating vents when possible. Wear wraparound sunglasses outdoors to protect from drying wind. Apply artificial tear ointment at bedtime if you wake with dry, scratchy eyes. For computer users, follow the 20-20-20 rule. Every 20 minutes, look away at something 20 feet away for 20 seconds. Position screens slightly below eye level to reduce tear evaporation. In conclusion, dry eye results from problems with tear production, quality, or evaporation. While more common in women and with increasing age, anyone can develop it. The symptoms can significantly impact daily life, but dry eye is highly treatable with options from simple artificial tears to prescription medications and procedures. Don't just suffer through it. Schedule an appointment with an ophthalmologist for proper diagnosis and a tailored treatment plan. With the right approach, most people achieve significant relief. Thank you for joining me today. If this was helpful, please subscribe and share with anyone dealing with dry eye. Until next time, take care of those eyes.